Next up, we have Dr. Elizabeth Miller, who is the Director of the Division of Adolescent and Young Adult Medicine at the Children's Hospital of Pittsburgh and Professor of Pediatrics at the University of Pittsburgh School of Medicine. And Dr. Miller will share her presentation titled Trauma-Informed Approaches to Sexual Violence Prevention and Intervention. So, welcome, Dr. Miller.
All right, I'm a clinician. Y'all just need to stand up for a moment. All right, let's do a little stretch, because a lot, right? Oh, take a few deep breaths in and out. Get some blood back into the brain, right? Okay. Yes. And that is certainly intended as a reminder that when we talk about trauma-informed care, it begins with us, right? Always, always, always remember to take care of you and do the self-care and self-care for each other, because we're in for the long haul. And so what a delightful, delightful day. And huge thanks to Dr. Cunningham and the team at the Injury Prevention Center. This has been one of the most beautifully organized conferences ever. It's been super smooth, and I've gotten so much out of this already. So thank you, thank you. So this is kind of the fun part, which is, wow, what are we going to do, right? Because we've thought about all of the complexities this morning. And again, not to diminish those complexities, but like to start thinking together about how we're going to take this on. These are, sort of complex solutions complex, problems do require complex solutions. And you heard Sarah this morning talking about the public health model and the multiple layers, the multiple components that need to go into this. And so I have 20 minutes to talk about our prevention work, and so I'm going to focus on a very narrow piece of the puzzle, which is college campus health centers. So college campus health centers have a really, really unique place in and on campuses. But I'm going to start with a question, because many of you work on college campuses and know that we function as responsible employees. Should a student come up to us and actually disclose to us that they've experienced a sexual assault, we are, and reporting requirements vary a little bit across campuses, but the idea is we're supposed to notify our leadership. So, college campus health centers are the staff employees within a campus health center responsible employees? Please put your hand up if the answer is yes. Oh, you guys are, oh, awesome. Okay. So very, very, this is exciting. This is not what I was expecting, because when I do this training in other places, a lot of people are under the impression that college student health centers, that staff and employees, clinicians included, must report. And the answer is we don't, because we are also bound by federal guidelines called HIPAA, which are our privacy guidelines. And so it actually turns out that on campus there is a critically important place for confidential services. And you've just heard from both Dr. McCauley and Dr. Lindquist about the critical importance of connecting students to those services and resources. And campus health centers and counseling centers are really those spaces where young people, our students, can actually seek confidential care. So just in terms of disclosures, I really have nothing to disclose, but I do collaborate with Futures Without Violence. And the funding for this particular project comes from the National Institutes of Health, from the National Institute of Alcohol Abuse and Alcoholism, and my program officer, Bob Freeman, is here. It's an incredible pleasure. It's been a wonderful partnership and co-learning with NIAAA in this process. So everybody, I think this slide has been up multiple times today, because it's like the AAU survey, right? We know this is like a big problem, so we skip on that. But because now we're going to get into the trauma-informed piece of this puzzle, right? So I've been doing gender-based violence prevention intervention work for 2 decades, and the multiple intersections of violence experiences that Dr. DeGue highlighted this morning for us, and the CDC's push to try to connect the dots across different violence victimization experiences, is the recognition that many students come to college having already experienced or witnessed domestic, dating, or sexual violence. And then you add, of course, to that adverse childhood experiences and witnessing community violence, which, if we have time, I will talk about later. But what the key piece here is that children who have had an experience of rape or attempted rape in their adolescent years are significantly more likely to experience rape or attempted rape in their first year of college. And we know from the National Intimate Partner Violence and Sexual Violence surveillance data is that the many women who have had experiences of completed rape have had that experience before the age of 18. So as a clinician who takes care of adolescents and young adults, this is squarely kind of this is my lane, because we're talking about experiences prior to college. You have also heard from many of our speakers today about this young women from ages 20 to 24 experiencing the highest rates of rape and sexual assault, followed by those 16 to 19. And that we really need to recognize that women, this is a problem for young women predominantly, although of course we also are increasingly understanding and recognizing the experiences of violence victimization for young men, as well as queer young people who are not necessarily on the binary. So in freshman year, we've also talked this morning about the increased vulnerability. And, it's one of these things when I'm doing these talks about sort of college health, and we start, talking to college health providers about freshman year, and you can start seeing light bulbs go off, right? It's like new environment, new context, you don't have the same set of friends, you don't certainly have your parents hovering quite as much. We still do have helicopter parents on college campuses, but they're not really doing that intensive monitoring anymore. And, as you see, every August with, fraternities across the country sort of saying, welcome parents and drop your freshman girls here, kinds of signs that there are sort of the targeting of freshmen also. So campus health centers, and just full disclosure, I actually take care of students at a local college campus and in their health services. And so I'm a big fan of campus health centers. They're easily accessible. Everybody goes to the health center, whether it's for a sprained ankle, a sore throat, runny nose, or something more serious. And you can also develop a pretty long-term relationship with students, range of visit types, and it's certainly a gateway to both on and off-campus resources. And a point about this is actually the campus health service where I work is a faith-based school, and they are not able to dispense contraception on school property. Just so happens that my adolescent clinic is across the street, and so we're like, hold that thought. Let's walk across the street. And so we do provide off-campus resources. And the students with the histories of partner violence and sexual violence do tend to use health services. And this last piece is actually something in the work that Dr. McCauley and I have done over the last number of years. In every clinic-based study that we've done, the lifetime prevalence of partner violence and sexual violence is significantly higher than the general population. And it's not a surprise, right? Because we know the serious health consequences of experiencing violence that manifest with a range of mental health symptoms, but certainly sleep disorders, difficulty with attention, as well as substance use and reproductive and sexual health concerns. And what we also know is that receiving medical care actually decreases women's risk for further sexual assault by an intimate partner by a good third, right? So getting young people connected to health care can be really good. And this health impact of violence, this Wordle, what I say to my learners who are learning clinical medicine with me is give me a health diagnosis and I will trace it back to trauma and violence for you, right? And so briefly, this college health center study, it's still ongoing. We actually collected our last final one-year follow-up survey last week. Woohoo. Yay. So 28 campus health centers in Western PA and actually in Western Virginia. And I'm going to tell you about the GIFTS intervention in a moment, but we tested it against a brief alcohol risk reduction counseling. And the intervention components I'm going to go into, but it's basically a universal education brief counseling intervention with an emphasis on harm reduction, emphasis on upstander behaviors, how you can be a better friend, as well as connection to victim service advocates. So first, the preliminary, sort of very, very preliminary, hot off the press findings, right? So from our baseline data. So we have 2,292 students in this sample. Very typical of college campus health centers, about 70% plus are identify as women in this sample. 41% experienced sexual violence before college. Right? If there's one take-home point that you all have, this is why Sarah this morning was talking about middle school, high school, and earlier, right? We have done an abysmal job in terms of sexual violence prevention in the early and mid-adolescent years. And then here students land on campus and we go, good luck with that, right? With really no sort of trauma-focused response for them. In our sample, about a third have also reported experiencing sexual violence since college, and about 60% reporting lifetime prevalence of sexual violence or intimate partner violence. And you can see the sex category differences there. And in terms of the overlap, right? So just think about these as sort of overlapping Venn diagrams. Not every student who experienced sexual violence before college goes on to experience sexual violence in college and vice versa, but there's plenty of overlap. And the contrast becomes far greater by gender of those who report sexual assault since college. 65% of women, 78% of people who are not cisgendered also experience sexual violence before college. And so there's lots and lots. I'm sort of flying through this, but I think the point being, you've heard in our just previous last two talks, people saying trauma-informed, right? I'm saying trauma-informed and trauma-focused. We actually need to be doing trauma-focused treatment here. So where's the alcohol piece fit in, right? So in terms of alcohol misuse, about a half of our students have binge drank at least once in the past month. This is not much different from any other of the college campus drinking studies. And about 18% drinking 10 plus drinks in a night, so heavy, the heavy episodic drinking that you heard Dr. Testa talk about earlier, and 11% reporting drinking an average of 3 plus times per week for the past year. So it's not only the weekend, right? And so just to give you, again, these are very preliminary, but I wanted to give you a sense of what the comparison is. And as you can see, in the sexual violence before college, 59% reporting binge drinking at least once in the past month, comparing to those students reporting no sexual violence before college. It's a little bit, it's a little bit lower at 45%. And you can see 19% to 17% on the heavy drinking, 14% to 10% on the frequency of drinking. So all of that to say that what we're seeing is that there's very likely to be a connection between these experiences of trauma and violence that increase the likelihood of our college students engaging in heavy episodic drinking, both probably through it's very possible that there's some emotion dysregulation, mental health symptoms, and sort of the coping with those mental health symptoms to drink, but there may also be drinking in order to put oneself in certain settings where, in order to essentially kind of numb the experience. And what we're doing currently is digging actually deeply into qualitative work, doing narrative interviews with students who are in this study, who we are able to tell, based on their survey responses, had both exposures to sexual violence before college and during college, to ask them to share their stories with us around the drinking and how the drinking sort of fits into these experiences of trauma. So Dr. McCauley went into the disability status of the students. And again, remember, this is a college health center study, and so the students seeking care are coming in with mental health symptoms, other physical health symptoms. So it's no surprise that about a quarter of our sample identify as having at least one disability. Most of the time, it is a psychiatric diagnosis or a learning disorder. And as you can see here, in terms of, to draw your attention to what is your far left, 73% of the students with any disability are reporting a history of sexual assault or partner violence. And so we're, no surprise, right, going into looking in much, much more detail about the increased vulnerability of students with disability. And what's interesting about this is we estimate about 11 to 12% of students on a college campus would fit into this category of endorsing at least one disability. Yet they make up only about 2 to 3% of students who are actually using services through the Office of Disability. So there's a really interesting sort of delta of students, which I know from my own clinical experience, is a student who'll come in saying, well, I was told I had ADHD and bipolar in high school, but I'm not taking my meds anymore because I don't need them. And so there's a lot of shedding, and as young adults are exploring their new identities, sort of in the context of college, that we're really going to need to figure out some strategies to support these students. And so where does the trauma-informed piece come from? And now y'all have to get really excited about this mnemonic because I worked on it for a long time. GIFts, right? So it's called Giving Information for Trauma Support and Safety, and it is a super simple, less than 10-second intervention. So I'm talking super duper brief. Discuss limits of confidentiality, provide universal education on consent, healthy relationships, harm reduction, do a direct assessment for partner violence and sexual violence, and if disclosed, certainly offer harm reduction strategies, a warm referral to advocacy services. That means not just handing a phone number, but saying, hey, is there anything we can do to help in terms of calling the advocate? Would you like the advocate to come here to meet you in clinic, et cetera? And the most important is this is not disclosure-based. So even if somebody doesn't disclose any experience of sexual assault, they receive information on resources as well as upstander behavior. Thus, the focus becomes really on prevention. And all of the patients who come in actually have access to services, not just those who disclose. So this is not a screening intervention. I don't care whether you're going to say yes or no on a screening question about violence experiences, because disclosure is not the goal. And we also recognize that victim service advocates, both on and off campus, are key team members in this work. So you saw in Heather's talk these palm-sized educational safety cards. And I, of course, left the entire box that I was planning to bring for you all up. So, but they're like small, like really, truly palm-sized educational cards, which have actually just gone through a whole new redo, mostly because none of us really liked that picture because it was just like too creepy. And so, and seemed too heteronormative and all of this stuff. We continue to learn and continue to do better as we listen to students who've been part of the study with us. So just know that it's being revised. And our idea here, right, is that everybody can benefit. Right? So it supports the Student Health Center's role in providing what we call in clinical medicine anticipatory guidance, this idea that, we're giving information to everybody because you may use this information. We encourage students to share the cards with their friends. It includes resources for students on how to help a friend and provides prevention messages and highlights bystander intervention. And in this case, bystander intervention is not only intervening with peers engaging in disrespectful or harmful behaviors, but also being a good friend to somebody who has disclosed a sexual assault. So it's really trying to script how can you be a really good support. And this framing the card for friends and family actually turns out to be probably the most important intervention component. Because what this is doing and what makes it trauma-informed is that it is actually about building resiliency. When we give information without pushing for disclosure, what we are doing is listening to survivors' voices. What survivors have said that they want from healthcare providers is no judgment, please listen, give me resources, and do not force me to disclose. And we have finally listened, I hope, and created an intervention that is really intended to say, could you please take this information because it may be relevant for you someday, but I bet you know somebody who can use this information. And it really then, because the disclosure rates are low among college students, and we just heard from Dr. Lindquist about sometimes that response isn't so great. Can we actually try to improve that response by strengthening the peer context to better support survivors? And the resiliency part about this is that it is, and when we've interviewed students about receiving the intervention, they said that part where you said I could share it with somebody made me realize I could pay it forward, right? And so it's about making connection. It's about having power. And that is really something we had not anticipated. It was certainly not in sort of the original design of this work, but has really emerged as probably the single most important factor. So now we're going to clean the data, yay. And we're actually doing a whole nother sort of detailed chart extraction because these are health centers. So I'm going to be able to tell you at some point how different young people were in terms of healthcare utilization, who were the frequent flyers in these clinics. We are also now embarking on interviews with students who are sexual and gender minority, as well as students with different abilities and accessibility needs, including reaching out to many more students on campuses who have physical and sensory impairment as well. And then we've created a learning collaborative with the 28 campus health centers and the offices of disability as well. So many, 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 many people to thank, including Dr. McCauley, who's a co-investigator on this study. And I've got a few minutes for questions. Yes. So the design of the study. So it is a cluster randomized control trial, 28 college campus health centers, with half of the sites randomized to the GIFTS intervention, the other half randomized to a brief alcohol risk reduction. And the outcomes, the primary outcome is actually recognition of sexual coercion, sexual violence. So we're really looking at knowledge and attitudes. And it's interesting, when I first started this work in clinic-based interventions, I kind of had this naive notion that what we were going to be doing was somehow waving a magic wand and making violence victimization go away. Imagine in a short clinical encounter, really what I finally realized we were doing in the clinical sort of encounter was really offering resources, becoming a touch point for our patients, and being able to say, you know what, this is a confidential space. I think what we've added with this intervention is saying, not only is this a confidential space for you, but for your friends. And I'm counting on you to keep an eye on your friends and to be able to bring them in here. And so it really is a knowledge and attitudes piece. Of course, are we measuring a lot of alcohol outcomes and a lot of the sexual violence outcomes for sure. But I finally got savvy and set as my primary outcome, increased knowledge of, sort of increased recognition of sexual coercion, a secondary outcome being increased knowledge of both on-campus and off-campus resources.
Hi. I work at Planned Parenthood, and we have your cards. They're great. Thank you.
Thank you.
And I think this is really good to talk about for college students and their access to health care. And we frequently see problems with college students not accessing health care because they don't have their insurance information. They're covered under their parents' insurance, and they don't have a card, and they don't want to tell their parent why they need to go to the doctor if they go and ask them. And they're worried about confidentiality, and a lot of times the assessment we do for our sliding fee scale can sometimes include their loans for school, which can be a lot. So it makes their services without insurance expensive sometimes. Mm-hmm. So I don't know if there's been any work done on, survey research to know like what students think about navigating the healthcare system or barriers that they experience or what to do about that.
Yeah, no, it's an excellent question. And towards the end of this month, we're all gathering at the American College Health Association meeting in D.C., of which always these issues around, health insurance and how do you fund college health and so forth, all these questions come up. And what I will say is the access to health services is extremely heterogeneous across. So it has to do with tiny campuses will only have a nurse and they'll refer out to an urgent care. Large campuses like Penn State, for example, have the fanciest, 30 exam room, salivate over beautiful community health center, essentially, and all kinds of things in between. How that gets funded varies from campus to campus, depending private or public, faith-based, not faith-based, and whether you're in a state that has Title V, Title X, and Title XX dollars that provides access to care for, which are federal dollars, family planning dollars, for young adults, right? And so for the most part, these campus health centers are essentially providing free, essentially if you're not going to use your parents' health insurance, there's still some opportunity for free care within the campus health centers, which is actually another sort of piece of this that I think is really interesting in terms of access. But it is the variability with which young people have to figure out navigating health services is rather dizzying. So I do actually have a separate technology grant out of NIH to design an app for young adults to help them navigate using geographic mapping and so forth to help them navigate actually getting to health services.
Okay. I run a reproductive health clinic for adolescents and women with disabilities at the main hospital, and I work in college health on campus. So your information about increased incidence of sexual assault for students with disabilities was amazing and great to hear that that is being looked at. Can you say if there are any, you said that the students with disabilities often didn't use the services for students with disabilities on campus. So are there any specific prevention measures? How do you reach these students? And are there any specific prevention measures for students with disabilities? As they mentioned in the LGBT community, campuses that had a more inclusive environment had lower rates of victimization for LGBT students. So what about students with disabilities? Have you looked at any of that?
Yeah, absolutely. That's a fabulous question. And I'm going to answer super briefly, which is that learning collaborative that I mentioned at the end, where our campus health centers, we have a Google group that we just basically have conversations like this once a month, really trying to generate ideas around what are some of the things that we could be doing to be more inclusive, to be sort of signaling to students who are coming in with different abilities, different histories of various diagnoses, like how do we actually, without stigmatizing those students, make them feel like there's a place that, that's a safe place for you. And so a lot of folks are talking about how do we do a campus health and wellness kind of, sort of campaign that says if you've ever had any of these kinds of symptoms, any kinds of, ever heard of, people with these kinds of disorders, know that the health center is a really good place to come. Our idea being that the health center would probably be the least stigmatizing place that could then connect to kind of a range of resources. So.
Thank you, Dr.
Thank you.